Hello and welcome to a new episode of The Dog is In. I'm Artemisia Dimostheni, a consultant neurosurgeon at Cleveland Clinic Abu Dhabi, and today we will talk about spine-related pain. 90% of the population will experience neck or back pain at some point in their lives. Here at Cleveland Clinic Abu Dhabi, we are running a spine care program with a multidisciplinary team that includes pain management, physical therapy, and neurosurgeons. I would like to introduce Dr. Jaya Batra, our consultant pain management physician, and Sarah Karajeh, our outpatient physical therapy manager. Dr. Jaya,
Hi.
Please tell us more about the initial management of patients who present to your clinic with neck or back pain.
The first important point whenever a patient comes to clinic is to make a correct diagnosis, which includes the chronicity of pain, whether it's an acute presentation or it's a part of the chronic pain syndrome. And to do that, we do assess the patient clinically. After proper clinical examination, patient is advised to do a battery of tests, which may include laboratory tests or some specific investigations for her or his spine. These investigations can be initially just x-rays, but they may also include the MRI scans for their back. And after the initial plan of assessment is done, we make the patients know that the first step is always conservative management of pain, which includes pain medications and referral to the physical therapy for assessment of their back and neck muscles and proper exercises and the rehabilitation program.
Thank you. Sarah, how does physical therapy look like? How frequent does a patient have to come to the physical therapy session, and what's the most important thing during this time?
So what we would normally do is we would assess the patients when they come in, and we're particularly looking at how do they move, how strong they are, how flexible they are. And once we've had a look at the problems and discussed it with the patient and set their goals, is we would start with maybe 4 sessions of physical therapy, depending on what they need. Now, during that time, we would maybe give them some exercise is to do at home, particularly important to be consistent with your exercise program. So when the patient comes back to see us again, we want to be trying to challenge them and improve them and make sure that they get the best out of each session.
What if the physical therapy sessions do not manage to improve the pain?
So if the patients are coming back after giving a reasonable trial of physical therapy sessions of 6 to 8 weeks, we do discuss with them other options of pain management. Now, the other options of pain management are in the form of pain interventional programs, which are according to the patient's symptoms. If the pain symptoms are more localized to lower back or lower neck, we offer them the treatments according to facet joint injections or sacroiliac joint injections. And if the pain is also radiating down to their legs, we do offer them epidural injections. There are other advanced procedures available like radiofrequency procedures in our clinic, and we do also offer PRP injections to the patient.
What medication are you using for these kind of injections?
Yeah, that's a good question because majority of our patients, they are worried about the type of medications used because the first and the most important medication which is used is cortisone. And people have a lot of myth about cortisone injections, but if it is given in a proper dose, which is a very low dose injected in localized areas, and if it is repeated at a particular frequency, it is safe to use. Except in few patients who have uncontrolled diabetes or very immunocompromised situations, but still the conditions are manageable for localized steroid injections.
So you just mentioned repeated frequency. So how often can such a procedure be repeated?
So there is no fixed timeline for repeating the procedures. It all depends upon how the patient is responding to pain interventions. But yes, 3 to 4 times the injections can be repeated in a year.
And what if that doesn't bring any improvement of the symptoms?
Yes, so if the interventions are not bringing any improvements to the symptoms, we do discuss them about referrals to neurosurgeon for definite management of their problems, which includes surgical options. And that's the last step in managing the patient's pain.
So for surgery, basically after reviewing the images and the patient's symptoms and after failed conservative treatment, we can offer surgical intervention in terms of disc surgeries with and without instrumentation, complex spinal tumor cases, vascular cases, and also scoliosis cases. We are using the most advanced tools and techniques for these procedures, trying to decrease the postoperative pain and to improve the recovery. But very essential for the postoperative recovery is actually to be consistent with physical therapy. So that's when we refer patients back to you, Sarah. So what is important for the postoperative care and course of the patient?
So we like to get the patient moving as soon as possible. So we might see the patient as an inpatient to try and encourage them to move and make sure they can get out of bed and perform their walking safely. And then once they come to the clinic, they'll still have a wound from the surgery. So we don't want to do anything too vigorous at first. And we start with a progressive exercise program that we monitor closely with the patient. And we'll start to see some improvements over time in their range of movement. And then we start to build up their strength. And we'll have follow-up appointments back with yourself. And we'll work closely together to make sure the patient gets back to full activity.
Is there anything else that can be done other than surgery and conservative treatment?
So there is another like last resort of pain management we can offer to the patients if patients have done physical therapy, tried all the medications, tried the interventional pain procedures, and even also they went for some laminectomies or some other spine surgeries, but still the pain is recurring or they are not getting better. We do offer them spinal cord stimulator trials and implants which target localized pain in a particular dermatome, and these are all very minimal invasive procedures which are done in our hospital. We do have patients for localized nerve issues, and for that patients who are not getting treated by any modality, we do offer them DRG implants as well.
Thank you, Dr. Jaya, and thank you, Sarah, for giving us this very important insights to this topic. I would like to highlight one more thing, that at Cleveland Clinic Abu Dhabi, we are running a multidisciplinary spine clinic where the patient has the unique opportunity with only one appointment to see 3 specialties: pain management, physical therapy, and neurosurgeon. This way, the best treatment plan can be provided for the patient. Additionally, I would like to highlight that at Cleveland Clinic Abu Dhabi, we are providing care in a culturally appropriate manner, where the patient have access to female physicians, nurses, and therapists. Thank you for watching us. Stay safe.